Good day, everyone. I am Stephanie Cherise Mascara, and today I will be discussing about behavioral system model of Dorothy E. Johnson. According to Dorothy E. Johnson, each individual has a predisposition to act with reference to the goal in certain ways rather than in other ways. First, we will be talking about the person behind this conceptual model. So Dorothy E. Johnson was born on August 21, 1919 in Savannah, Georgia. In 1942, she graduated her Bachelor of Science in Nursing from Vanderbilt University in Nashville, Tennessee. In 1948, she graduated her Master's in Public Health from Harvard University in Boston, Massachusetts. From 1949 until her retirement in 1978, she was an assistant professor of pediatric nursing, an associate professor of nursing, and a professor of nursing at University of California in Los Angeles. She died in February 1999 at the age of 80. 1975, Dorothy Johnson received Faculty Award from graduate students. In 1977, she received Lulu Hasenfeld Distinguished Achievement Award from the California Nurses Association. In 1981, she received Vanderbilt University School of Nursing Award for Excellence in Nursing. Dorothy Johnson's model was influenced by Florence Nightingale's book, Notes on Nursing, System Theory, and her clinical work in pediatrics. Her philosophical endeavors assisted in the expansion of the behavioral system theory. She defined nursing as an regulatory force which acts to preserve the organization and integration of the patient's behaviors at an optimum level under those conditions in which the behaviors constitutes a threat to physical or social health or in which illness is found. Four goals of nursing to assist the patient. First, whose behavior commensurate with social demands. Second, who is able to modify his behavior in ways that it supports biological imperatives. Third, who is able to benefit to the fullest extent during illness from the physician's knowledge and skill. Lastly, whose behavior does not give evidence of a necessary trauma as a consequence of illness. Dorothy Johnson first proposed her model of nursing care in 1968 as fostering of the efficient and effective behavioral functioning in the patient to prevent illness. She also stated that nursing was concerned with man as an incorporated whole, and this is the specific knowledge nurses must require. In 1980, Johnson published her conceptualization of behavioral system model for nursing, where she explains her definition of the behavioral system model. For the meta paradigm, first is the person. Johnson views a person as having two major systems, the biological system and behavioral system. It is the role of medicine to focus on the biological system, whereas nursing's focus is on the behavioral system. Second is health. Health is an elusive state that is affected by social, psychological, biological, and physiological factors. Johnson's behavioral model supports the idea that the individual is striving to retain some balance or equilibrium. Third is environment. According to Johnson, an individual's behavior is influenced by all events in the environment. Cultural influences on the individual's behavior are viewed as profound. And the last one is nursing. The primary goal of nursing is to cultivate equilibrium within the individual, which allows for the practice of nursing with individuals at any point in the health illness continuum. And there are 7 behavioral subsystems. Attachment or affiliative subsystem. The attachment or affiliative subsystem is well known as the earliest response system to expand in the individual. The most favorable functioning of the affiliative subsystem allows social inclusion, closeness, and a pattern and continuance of a strong public band. Dependency subsystem. The dependency subsystem is distinguished from the attachment subsystem. Dependency behaviors are actions that trigger nurturing behaviors from other individuals in the environment. The product of dependency behavior is consent, interest or appreciation, and physical support. Ingestive subsystem. The ingestive subsystem relates to the behaviors surrounding the ingestion of food. It is associated to the biological system. The perspective is in the significance and arrangement of the social events surrounding the occasions when food is eaten. Eliminative subsystem. The eliminative subsystem relates to the behaviors surrounding the secretion of waste products from the body. Human cultures have defined different socially acceptable behaviors for excretion of waste, but the continuation of such an outline remains from culture to culture. Sexual subsystem. The sexual subsystem imitates behaviors related to procreation or reproduction. Both biological and social factors are involved behaviors in the sexual subsystem. Behaviors also vary according to the gender of the individual. Aggressive subsystem. The aggressive subsystem relates to behaviors concerned with defense and self-preservation. Johnson sees the aggressive subsystem as one that creates defensive responses from the individual when life or territory is threatened. Achievement subsystem. The achievement subsystem contains behaviors that attempt to control the environment. Intellectual, physical, imaginative, mechanical, and communal skills are some of the areas that Johnson distinguishes. Personal accomplishments or success may also be integrated in this subsystem. Assumptions about the structure. First is the drive or goal, which is the reason or motivation for behaviors in the subsystem. Second is set, which is repair, normal behavior a client to use to meet the goal of the subsystem. Third is choices, which refers to the alternate behaviors the person consider in any given situation. Options are influenced by such variables as age, sex, culture, and socioeconomic status. The last one is the action, which is the observable behavior of the person. Assumptions about the functions. For behavior to be maintained, it must be protected, nurtured, and stimulated. Protection from noxious stimuli that threaten the survival of the behavioral system. Nurturance, which provides adequate input to sustain behavior, and stimulation to continue growth of the behavior and counteract stagnation. Acceptance by the nursing community. Practice. The Johnson Behavioral System Model was used to develop a self-report and observational instrument to be carried out with the nursing process. The implementation of the instrument provided a more comprehensive and organized step to assessment and intervention, thereby increasing patient and nurse satisfaction with care. Education. A core curriculum based on a person as a behavioral system would have definite goals and clear course of planning. The study would center on the patient as a behavioral system and its dysfunction, which would necessitate the use of the nursing process. Research. Nursing research, according to Johnson, is vital to explain and identify the behavioral system disorders which arise in relation with illness and develop good reasoning for the means of management. The theory resulting from the behavioral system model influences the researcher to choose between two options. And that's all. Thank you so much for listening and watching. I hope that you have learned something.